everybody. We're going to talk about the new pneumatic tourniquet. We got rid of the old one. This is the new one. It is much easier to use. So I'm going to show you how to use it, and then we're going to talk through some indications and things like that. First things first is it does have a plug. Please plug it in. You're going to hit this on button right here in the middle. That is the power button. It sounds like it's inflating as it's turning on. It is not. We tested it. It is not inflating. This is the calibration that happens at first. So once you place the cuff on the patient's arm, then you can set all of your parameters. So I'm going to use myself. Okay. So this is auto set for 1 hour and at a pressure of 250. You want to adjust that to meet your patient's needs. This is your edit button. So click the edit and it will, they will blink so you know that you're editing. So we're gonna dial this down to 100 because I don't want to kill my arm. And then we're gonna do this for 1 minute versus 1 hour. Okay. Then you're going to click the check mark to lock in your settings. This is the inflate button and this is the deflate button. So you'll click inflate and it will start inflating. It tells you what your pressure is. This time goes to 0 because it goes backwards. So it'll say 1 minute, 2 minutes, 3 minutes, things like that. So things to know about indications and when to use this. So you want to use this on controlled, uncontrolled hemorrhages. So how do you know to use a cat tourniquet versus a pneumatic? If a patient is missing a limb, you're going to use a cat tourniquet for the most part. If they have an arterial bleed from a laceration, you can use a pneumatic. It's also physician discretion, so whatever you would like. We have 4 different size cuffs, 2 for the arms, 2 for the legs. Depends on the size of your patient. Most of our patients are going to fit an 18, which is what I have on my forearm. Do not put this over a joint, so don't put it over your knee, don't put it over your elbow, don't put it over a fistula if you can help it. Sometimes we absolutely have to, but try not to. You'll put the sleeve on first. The sleeve comes in the package and it looks like this. So you'll put the sleeve on if you can to protect the patient's skin. This is what that alarm sounds like. So I'm going to hit silence while I finish telling you. The silence button is right at the top and then it illuminates here telling you that you have hit your time. It won't auto deflate until you tell it to, but now I've hit my max time that I have set. The other thing is how high do you make this? Typically, rule of thumb is 50 over the systolic for your arm and 100 over the systolic for your leg. The biggest thing is that you want to have our limb occlusion pressure, and so what that means is that you want to inflate it enough so that way I lose my radial pulse or the pulse in my leg, and that's how you know if you've inflated it enough and the bleeding will stop. Once the wound has been sutured or you're ready to take down the tourniquet, you're going to press and hold this button right here, and then it will start the deflation process, and it will tell you how quickly. There is no rule of thumb of how fast you deflate. You just hit the button and deflate. Good thing to do is to hold pressure on the wound so that way if it starts bleeding, you already have a dressing over it, and then slowly release your dressing once this has come down. The last thing that I want to tell you is we will have a tip sheet on here on like inflation pressures and things like that. But if you have any questions, just let us know. We're happy to support you.